Dr. Sarah Chen stepped through the gleaming corridors of the Galactic Medical Academy, her worn emergency kit bouncing against her hip with each stride. The sterile white walls hummed with soft bioluminescent strips that adjusted their intensity based on the diverse visual needs of dozens of alien species. She had arrived on Kepler Station just 3 rotations ago as part of the first human exchange program, and already the whispers followed her everywhere she went. The Deathworlder, they called her in hushed tones when they thought she couldn't hear. From that nightmare planet where everything tries to kill you. Sarah suppressed a bitter laugh. If only they knew how wrong they were. Earth wasn't trying to kill humans. Earth had made them stronger. The lecture hall buzzed with nervous energy as nearly 200 medical students from across the galaxy took their seats. Crystalline Zalari perched on specialized platforms that accommodated their silicon-based physiology, while the gaseous Vorthan students occupied containment suits that allowed them to participate in solid matter environments. Insectoid Kythera clicked mandibles, and what Sarah had learned was their equivalent of anxious muttering. Professor Veltar, a distinguished Altarian with skin that shifted through calming blue hues, gestured for silence with one of his forearms. Today we begin advanced trauma response training. As future medical practitioners serving diverse worlds, you must be prepared for any emergency. A Kythera student, her compound eyes glittering with curiosity, raised a chitinous arm. Professor, is it true that the human will be demonstrating her species' medical techniques? The question sent a ripple of excitement and apprehension through the gathered students. Sarah felt the weight of hundreds of eyes upon her, some filled with fascination, others with barely concealed fear. Professor Veltar's skin flickered to a diplomatic shade of purple. Dr. Chen has graciously agreed to share human emergency protocols with us. However, I must warn you all that Deathworld medicine can be quite intensive. Intensive, squeaked a small Fluffkin student, their cottony exterior trembling. What does that mean? Sarah stood slowly, noting how several students unconsciously leaned back. At 5 feet 6 inches, she was hardly imposing by human standards, but, here among species that had evolved on gentle worlds with stable climates and few natural predators, she might as well have been a titan. It means, Sarah said quietly, her voice carrying easily across the silent hall, that where I come from, there's no time to be gentle when someone's dying. The Altarian professor's skin shifted to nervous yellow. Perhaps we should start with basic theory first, Dr. Chen. Theory is fine, Sarah replied, settling her emergency kit on the demonstration table with a metallic thud that made several students flinch. But, theory doesn't save lives when someone's bleeding out in front of you. A Zalari student's crystalline face reflected the overhead lights as she spoke. On our homeworld of Praxis, medical emergencies are rare. Our environment is carefully controlled, and our physiology is quite resilient. We've never encountered the concept of bleeding out. Sarah nodded, understanding. She'd spent weeks studying the various species represented here, and it had been eye-opening. The Zalari lived on a world where the weather had been artificially stabilized for millennia. The Fluffkin came from a planet with gravity so gentle that falling was virtually impossible. Even the supposedly hardy Kythera originated from a world where the most dangerous predator was roughly equivalent to Earth's butterflies. Let me ask you something, Sarah said, addressing the room. How many of you have ever treated a traumatic injury? A few tentative appendages rose. Professor Veltar translated their responses. Student Zixera here once treated a Vorthan who suffered a containment suit malfunction. The patient experienced mild disorientation when exposed to solid matter for 30 seconds. Sarah raised an eyebrow. And the treatment? A soothing mist and 3 days of rest in a comfort pod. Student Kilmoth treated a Fluffkin who fell from a height of 2 feet. The patient suffered minor compression to their fluff matrix. Treatment? Sarah asked. Gentle refluffing and calming harmonics for a week. Sarah looked around the room at the expectant faces. These beings had never known real danger, never felt the adrenaline surge that came with a life-or-death emergency. Their medical training was built around comfort, rest, and gradual healing in sterile, controlled environments. Where I come from, she said, pulling a battered tablet from her kit, this would be considered a routine Tuesday. She activated the holographic display, showing a scene that made half the audience gasp in horror. The image showed a human medic working on a trauma patient in what was clearly a battlefield environment. Debris flew overhead while the medic calmly inserted in 4-line into a patient with multiple visible injuries. This is Dr. Marcus Webb, Sarah explained as several students made distressed noises. He's treating a soldier who took shrapnel from an improvised explosive device. Notice how he's working while under active fire. A Fluffkin student's fluffy exterior had compressed to barely half its normal size in what Sarah recognized as their fear response. But, where's the sterile environment? The safety protocols? The comfort measures for the patient? There aren't any, Sarah replied simply. When someone's dying, you work with what you have, where you are, as fast as possible. Dr. Webb has approximately 4 minutes to stabilize this patient's blood pressure and establish an airway, or the patient dies. The Kythera student's mandibles clicked rapidly. Dies? Actually dies? Not just becomes uncomfortable? Sarah's expression grew somber. Actually dies. Permanently. No recovery period, no comfort pod, no second chances. Professor Veltar's skin had shifted to a pale, distressed white. Dr. Chen, perhaps this is too advanced for first-year students. With respect, Professor, Sarah said, this is basic emergency medicine where I come from. Every human paramedic, every combat medic, every emergency room doctor has dealt with scenarios far more intense than this. We don't have the luxury of stable environments and weeks of recovery time. She changed the holographic display to show statistics that made the alien students emit sounds of shock and disbelief. Human emergency responders regularly work in environments with temperatures ranging from -40 to +50 degrees Celsius. We treat patients while hurricanes rage overhead, during earthquakes that are literally tearing the ground apart, and in combat zones where the medical team is actively being targeted by enemy forces. A Zalari student's crystalline structure was vibrating with stress frequencies. How do you maintain precision under such conditions? Our medical procedures require absolute environmental stability. Sarah smiled grimly. We adapt. We improvise. We overcome. She pulled out a piece of equipment that looked disturbingly primitive compared to the sleek alien medical tools. This is a combat tourniquet. It's designed to stop arterial bleeding in 30 seconds or less, even when applied by someone with minimal training, in complete darkness, while under fire. The demonstration dummy she activated made several students cry out in alarm. It was designed to simulate various Earth trauma scenarios, complete with realistic bleeding, realistic bone breaks, and realistic tissue damage. To the alien students, it looked like an instrument of torture. Now, Sarah said, noting how the Fluffkin students had pressed themselves against the back wall, who wants to learn how to save a life when every second counts? The silence that followed was deafening. These students, brilliant in their own ways, had never encountered medicine as warfare against death itself. They had never felt the urgent pressure of working against time while a patient's life ebbed away beneath their hands. Professor Veltar's skin cycling through confused colors. Dr. Chen, I think we need to reconsider our approach. Perhaps we could start with human medical theory instead of practical applications. Sarah looked around the room at the terrified faces. She understood their fear. These beings had evolved in safe environments where medicine was a gentle art focused on comfort rather than desperate battles against mortality. But she also knew that somewhere in the galaxy, beings were dying who could be saved if their doctors understood what humans had learned through millennia of surviving on a world that constantly tested their limits. All right, she said finally, setting aside the tourniquet. Let's start with theory. But I want you all to understand something first. She activated one final holographic display, this one showing Earth from orbit. The beautiful blue marble that had birthed humanity looked deceptively peaceful from space. This is my home, she said quietly. A world where storms can level cities, where the ground can literally split open without warning, where microscopic organisms can kill in hours, and where gravity is strong enough to kill you instantly if you fall wrong. Every human in this room represents millions of years of evolution on a world that never stopped trying to kill us. The alien students stared at the image with newfound understanding and not small amount of fear. We didn't become doctors despite coming from a death world, Sarah continued. We became doctors because of it. Every technique I'll teach you, every procedure I'll demonstrate, was developed by beings who learned medicine in the crucible of survival. When you go back to your gentle worlds with your controlled environments, remember that somewhere in this galaxy, there are humans working miracles with primitive tools in impossible conditions, saving lives that any sane species would consider already lost. She paused, letting her words sink in. Now, shall we begin with basic human anatomy and physiology? I promise it gets much more interesting when you understand just how much punishment the human body can take and still keep fighting. The murmur that rose from the assembled students was a mixture of anticipation, fear, and grudging respect. They were about to learn medicine from beings who had spent their entire evolutionary history proving that death was not the final word in any emergency. Professor Veltar's skin settled into a resigned shade of gray-blue. Very well, Dr. Chen. Please proceed. But perhaps we should warn the medical staff to have comfort pods standing by for any students who become overwhelmed. Sarah's smile was sharp and proud. Professor, by the time I'm done with your students, they'll understand why humans don't need comfort pods to function under stress. We'll start with the cardiovascular system and work our way up to emergency surgery. The gasps from the assembled students suggested that their real education was just beginning. 3 days into Dr. Chen's intensive training program, the Galactic Medical Academy had transformed into something resembling organized chaos. What had begun as horrified fascination among the alien students had evolved into reluctant admiration mixed with genuine terror at the depths of human medical knowledge. Sarah stood before a holographic projection of a human heart, its 4 chambers pumping with mechanical precision while the assembled students watched in disturbed silence. To beings accustomed to simple, efficient organ systems, the human cardiovascular network looked like an impossibly complex mechanical nightmare. The human heart, Sarah explained, highlighting different sections with her pointer, beats approximately 100,000 times per day, pumping over 5 liters of blood through nearly 100,000 kilometers of blood vessels. She paused as several students made distressed noises. All of this occurs automatically, without conscious thought, while humans engage in activities that would be immediately fatal to most other species. Student Zixara, the Vorthan in the containment suit, bubbled with confusion. Dr. Chen, how is this possible? Our cardiac equivalents process nutrition solution through approximately 12 meters of distribution channels. The complexity you describe seems unnecessarily dangerous. Sarah smiled grimly. That's because your species evolved in an environment where efficiency was sufficient. Humans evolved where efficiency wasn't enough. We needed redundancy, adaptability, and the ability to function under extreme stress. She activated a new display showing human blood composition. The alien students recoiled as though she had just shown them weapons-grade toxins. Human blood contains red blood cells that carry oxygen, white blood cells that actively hunt and destroy threats to the organism, and platelets that seal injuries automatically. But here's what makes it interesting to emergency medicine. Sarah withdrew a small device from her kit. This is a portable blood analyzer. Human emergency responders can determine blood type, toxin levels, infection markers, and dozens of other variables in under 60 seconds. We can then adjust treatment in real time based on this information. The crystalline Zalari student, whom Sarah had learned was named Silvera, chimed with harmonics that translated to incredulity. Real-time analysis during treatment? But what about proper laboratory conditions? Sterile environments? Careful measurement protocols? When someone's bleeding to death, you don't have time for laboratory conditions, Sarah replied matter-of-factly. You work with field conditions and adapt. She activated the training mannequin again, this time programming it for a severe hemorrhage scenario. The artificial blood that began flowing from the dummy's simulated injuries was realistic enough to send the Fluffkin students into distressed fluffing patterns. Kilnara, Sarah called to the Kithiera student, come assist me. The insectoid student's compound eyes reflected panic as she chittered nervously. Dr. Chen, I don't think I'm qualified to. You're not, Sarah interrupted calmly. Neither is anyone else in this room by human standards. That's why we're training. She gestured to the bleeding mannequin. This patient has severed a major artery. You have approximately 3 minutes before blood loss causes irreversible brain damage. What's your first priority? Kilnara's mandibles clicked rapidly as she consulted the gentle medical protocols she had been taught. Comfortable positioning? Calming harmonics? Perhaps a mild sedative to reduce stress? Several other students nodded agreement, suggesting various comfort measures and gradual treatments that would take hours to implement. Sarah shook her head. The patient is unconscious in 90 seconds. Dead in 3 minutes. Comfort isn't the priority. Stopping the bleeding is. She demonstrated with swift, efficient movements that made the alien students flinch. Direct pressure here, elevation of the extremity, tourniquet application if pressure fails.
The tourniquet's rapid application drew gasps from the assembled students.
The device's function seemed brutal and primitive to beings accustomed to gentle healing techniques. But, you're restricting circulation entirely, protested Kilmoth, the Fluffkin student.
Doesn't that damage the tissue?
Temporary circulation restriction to prevent total system failure, Sarah explained, monitoring the mannequin's simulated vital signs.
You can regenerate damaged tissue. You can't regenerate a dead patient. Professor Veltar's skin had been cycling through distressed colors for the entire demonstration.
Dr. Chen, while I appreciate the educational value, I'm concerned about the psychological impact on our students.
Perhaps we could focus on less aggressive treatments?
Sarah paused, studying the alien faces around her.
These beings genuinely couldn't comprehend medicine as an urgent battle against death.
Their evolutionary backgrounds simply hadn't prepared them for the concept of decisive, potentially harmful interventions to prevent greater harm. Let me tell you about Dr. Elena Vasquez, she said, deactivating the mannequin and settling into what she recognized would be a crucial teaching moment. She's a human emergency physician working in one of Earth's most dangerous regions. Last year, she treated over 3,000 trauma cases. The numbers alone made several students emit distressed sounds. During one shift, she had 17 critical patients arrive simultaneously. A building collapse had trapped workers underground for 6 hours. When they were finally extracted, Dr. Vasquez had to perform surgery on multiple patients at once, with limited equipment, no backup power, and, while aftershocks continued to shake the building. She activated a new display showing the aftermath of the emergency. The alien students stared in horror at images of humans working calmly in what looked like a war zone. She saved 14 of the 17 patients. The 3 who died were beyond help when they arrived. Dr. Vasquez worked for 18 consecutive hours without rest, food, or even water breaks. A Vorthan student's containment suit flickered with emotional stress patterns.
18 hours? Without rest? How is this physically possible?
Humans can push their physiology far beyond normal limits when necessary, Sarah explained. We have stress responses that temporarily increase strength, speed, and mental acuity. Our adrenal glands flood our systems with chemicals that allow us to function beyond our normal capabilities. She pulled up a comparison chart that made the alien students recoil in shock. During extreme stress, human reaction times can improve by 30%, pain sensitivity decreases by up to 50%, and strength can increase by 20%. We literally become more capable when faced with life-threatening situations. The crystalline Zalari student was vibrating with harmonic patterns that Sarah had learned indicated deep confusion.
But this seems maladaptive. Why would evolution favor responses that push organisms beyond safe operational parameters? Sarah's expression grew serious. Because sometimes safe operational parameters aren't enough to survive. Sometimes you have to risk everything to save anything. She began setting up a new training scenario, this time one that would demonstrate human diagnostic capabilities under pressure. Dr. Chen is about to show you something that will challenge everything you think you know about medical assessment. The device she withdrew looked disturbingly primitive to the alien students. It was simply a tubular instrument with earpieces connected by flexible tubing. This is a stethoscope, Sarah explained, noting their puzzled expressions. Invented on Earth over 200 years ago, and still one of our most valuable diagnostic tools. She activated the training mannequin for a cardiac emergency scenario. This patient is experiencing chest pain. Using only this primitive device and my hands, I'm going to determine the exact nature of the cardiac problem, its severity, and the appropriate treatment. The alien students watched in fascination as Sarah placed the device against various points on the mannequin's chest, her expression focused and intent. After less than 30 seconds, she straightened. Acute myocardial infarction, anterior wall, moderate severity. Treatment protocol involves immediate anticoagulation, pain management, and preparation for emergency cardiac intervention. Professor Veltar's skin shifted to skeptical orange. Dr. Chen, our diagnostic systems require minutes of scanning with sophisticated equipment. How could you possibly determine so much information so quickly? Sarah smiled. Because humans developed medicine in an environment where sophisticated equipment wasn't always available. We learned to use our own senses as diagnostic tools. She demonstrated techniques that seemed almost magical to the alien students. Reading pulse rates through fingertip pressure. determining respiratory efficiency by observing chest movement patterns,
assessing neurological function through simple verbal and motor tests. Human emergency doctors can perform a complete trauma assessment in under 2 minutes using nothing but their hands, eyes, and ears, she explained as the students watched in growing amazement. We can detect internal bleeding, brain injuries, spinal damage, and dozens of other conditions without any equipment beyond basic tools. A Kythera student chittered nervously. But, how do you ensure accuracy? What about false readings? Misdiagnosis? Human doctors train for years to develop these skills, Sarah replied. We practice on thousands of patients, in hundreds of different environments, under every conceivable condition. Our diagnostic accuracy under emergency conditions is actually higher than many automated systems because we can adapt to variables that machines can't account for. She began setting up what looked like the most complex training scenario yet. Multiple mannequins, each programmed for different emergency conditions, were arranged in what appeared to be a mass casualty simulation. This is called triage, Sarah announced, causing immediate distress among the assembled students. When you have more patients than resources, you have to make decisions about who gets treatment first. The alien students' reactions ranged from horror to complete incomprehension. The concept of deliberately choosing which patients to treat seemed antithetical to everything they understood about medical ethics. But, every patient deserves equal care, protested the Fluffkin student. How can you possibly choose between lives? Sarah's expression grew somber. Because choosing to treat everyone equally when resources are limited often means everyone dies. Human emergency medicine teaches us to maximize lives saved, even if it means making difficult decisions. She began demonstrating triage protocols, moving rapidly between mannequins and making quick assessments. This patient has severe but survivable injuries. Immediate treatment. This one has minor injuries that can wait. Delayed treatment. This one. She paused at a mannequin programmed for unsurvivable trauma. This one is beyond help. Comfort care only. The silence that followed was profound and disturbed. These aliens had never conceived of medicine that involved accepting the inevitable loss of some patients in order to save others. In human emergency medicine, Sarah continued quietly, we've learned that trying to save everyone sometimes means saving no one. It's not about caring less. It's about caring enough to make the hardest decisions possible. Professor Veltar's skin had settled into a deep, thoughtful blue. Dr. Chen, what you're describing challenges the fundamental assumptions of medical practice as understood by most galactic civilizations. Sarah nodded. Because most galactic civilizations developed medicine in stable, controlled environments where time and resources were abundant. Humans developed medicine as a desperate fight against death itself, where every decision mattered and there was never enough time to save everyone you wanted to save. As the training session concluded, the alien students sat in stunned silence, processing concepts that challenged everything they had been taught about medical practice. They were beginning to understand that human medicine wasn't just technically different from their own, it was philosophically different at the most fundamental level. Sarah packed her equipment with practiced efficiency, noting the thoughtful expressions on the alien faces around her. Tomorrow would bring even more challenging lessons, as she introduced them to human surgical techniques and emergency procedures that would test the limits of their understanding. Questions for next session, she asked. The Kythera student raised a chitinous arm tentatively. Dr. Chen, how do humans cope with the psychological stress of making these kinds of decisions? Sarah's smile was sad and proud simultaneously. That, Kilnara, is perhaps the most important question you could ask. And, the answer will help you understand why human medics are different from every other species' medical personnel in ways that go far beyond technique. The emergency alert that shattered the normal rhythm of Kepler Station came at the worst possible moment. Sarah had just begun demonstrating advanced human surgical techniques to the increasingly overwhelmed alien medical students when the station's emergency klaxons began their urgent wailing. Professor Veltar's skin immediately shifted to alarm patterns of bright red and orange. All students to emergency positions, he announced, his forearms gesturing frantically. This is not a drill. Through the lecture hall's viewports, Sarah could see the approaching ship that had triggered the alert. It was a Kythera research vessel, its normally pristine insectoid design marred by what looked like collision damage. Atmospheric breach warnings flickered across the station's communication displays. Multiple casualties aboard research vessel Hivesinger, came the announcement through the station's communication system.
Estimated 23 injured, severity unknown. All medical personnel to emergency stations immediately. Sarah watched as the alien medical students began their practiced but leisurely emergency response procedures. They moved with careful precision, checking equipment inventories, reviewing patient comfort protocols, and consulting detailed emergency response manuals that had clearly been written for controlled, predictable situations. Dr. Chen, Professor Veltar called, his skin cycling through uncertain purples, perhaps you should observe our emergency protocols rather than participate directly. Our systems are quite different from human procedures. Sarah looked at the damaged ship through the viewport, then, at the alien medics who were still in the preparation phase of their response, and felt her human emergency training override her diplomatic instincts. Professor, with respect, that ship has been venting atmosphere for the past 3 minutes. If there are casualties aboard, they don't have time for preparation protocols. Before anyone could respond, Sarah had grabbed her emergency kit and was moving toward the emergency bay with the swift, purposeful stride that her human training had drilled into her. Behind her, she could hear the confused chittering and musical tones of alien students trying to understand why she was ignoring established procedures. The emergency bay was a marvel of alien medical technology, with sophisticated life support systems, advanced diagnostic equipment, and comfortable treatment pods designed for extended recovery periods. It was also completely wrong for an emergency situation involving immediate threats to life. Sarah began rapidly reconfiguring the space, moving equipment and clearing areas for urgent treatment. The alien medical staff watched in confusion as she essentially ignored their careful preparations in favor of what looked to them like chaotic improvisation. Dr. Chen called Dr. Velnesh, the station's chief medical officer, "You're disrupting our emergency protocols. Please step aside and allow our trained personnel to handle this." "Your trained personnel are moving too slowly," Sarah replied without stopping her preparations. "That ship has multiple hull breaches and failing life support. The casualties aren't going to wait for your comfort protocols." The first transport shuttle arrived from the damaged research vessel, and Sarah's worst fears were confirmed. The Kythera researchers being carried in were suffering from severe decompression injuries, atmospheric toxicity, and what appeared to be impact trauma from whatever had damaged their ship. The alien medical staff immediately began their standard intake procedures, moving the injured Kythera to diagnostic scanners for complete analysis before beginning treatment. It was thorough, careful, and far too slow for the severity of the injuries Sarah could see. "Stop," she said firmly, moving to intercept the medical team carrying what was clearly the most critically injured patient. "This one first. Severe internal trauma, probable hemothorax, declining consciousness. He has minutes, not hours." Dr. Velnesh's tentacles writhed with indignation. Dr. Chen, we cannot simply bypass proper diagnostic procedures. Our protocols require complete analysis before treatment begins. "Your protocols are going to kill him," Sarah replied bluntly, pulling out her primitive-looking human diagnostic tools. "Look at his respiratory pattern, the asymmetrical chest movement, the declining responsiveness. He's bleeding into his chest cavity and drowning in his own blood." She began working with the swift efficiency that her training had made automatic, using her stethoscope and hands to assess the patient's condition while the alien medical staff watched in growing alarm. "Immediate chest decompression required," she announced, reaching for equipment that would allow her to insert a chest tube to drain the accumulated blood and air. "Someone get me a thoracostomy kit, now." "Dr. Chen, you cannot perform invasive procedures without proper authorization and diagnostic confirmation," Dr. Velnesh protested. "Our regulations strictly forbid." "Your regulations don't account for emergency situations where waiting for authorization equals death," Sarah interrupted, continuing her rapid assessment. "This patient needs immediate intervention or he dies in the next 5 minutes." The alien medical staff stood frozen, caught between their careful protocols and the increasingly obvious deterioration of the patient. Their training had simply never prepared them for situations where immediate action was required without complete diagnostic confirmation. Sarah made a decision that would have horrified medical ethicists on a dozen worlds but was routine for human emergency physicians. She began treating the patient using human protocols, taking responsibility for the outcome regardless of alien regulations. Working with tools that looked primitive compared to the sophisticated alien equipment, she quickly established the chest decompression that the patient desperately needed. The immediate improvement in his breathing pattern was obvious to everyone present. "How did you know?" asked Dr. Zilkara, a young Kythera physician who had been watching in fascination. Our diagnostic systems hadn't completed their analysis.
Pattern recognition developed through emergency training, Sarah replied, continuing her rapid treatment.
Humans learn to make life-saving decisions with incomplete information because waiting for complete information often means the patient dies. She moved to the next most critical patient, a Kythera researcher suffering from what appeared to be severe atmospheric poisoning. The alien medical team was preparing for a lengthy detoxification protocol that would take hours to complete. Hemofiltration, now, Sarah announced, beginning to set up equipment for directly filtering the toxins from the patient's circulatory system.
We can clear the toxic compounds in 30 minutes instead of 8 hours.
But, that's extremely invasive, protested one of the alien physicians.
The risks of such aggressive treatment are lower than the certainty of death from continued toxic exposure, Sarah finished.
Sometimes aggressive treatment is the conservative choice.
As she worked, more casualties arrived from the damaged research vessel. Sarah found herself essentially running triage for the entire emergency, making rapid decisions about treatment priorities while the alien medical staff struggled to adapt their protocols to the urgent situation.
Dr. Chen called out student Kilnara, the Kythera student from her classes. This patient is showing signs of neurological trauma. Our protocols suggest immediate rest and gradual assessment over several days.
Sarah looked at the patient Kilnara was indicating and immediately recognized the signs of increasing intracranial pressure.
The alien protocols would result in brain death long before the gradual assessment was complete. Cranial decompression, immediately, she ordered. This patient has an expanding hematoma that's crushing brain tissue. We have maybe 20 minutes before irreversible damage occurs. The surgical procedure that Sarah began performing was unlike anything the alien students had ever seen.
Working with speed and precision that seemed impossible to beings accustomed to careful, gradual medical procedures, she essentially saved the patient's life while teaching real-time emergency neurosurgery to a fascinated audience.
The key, she explained while working, is accepting that perfection isn't possible in emergency situations.
You aim for good enough to save the life, then worry about optimal later.
Dr.
Velnesh watched the proceedings with growing amazement as Sarah moved between patients, making rapid decisions and implementing treatments that violated every careful protocol in the galactic medical textbooks but consistently produced positive results.
Dr. Chen, he said finally, I must admit that your methods are proving remarkably effective. But, how do you maintain quality control without proper diagnostic procedures?
Sarah paused in her treatment of a patient with multiple crush injuries to address the question that went to the heart of the difference between human and alien medical philosophy. Human emergency medicine is based on acceptable risk calculation, she explained. We accept the small risk of inappropriate treatment in order to eliminate the large risk of death from delayed treatment. Our training focuses on making accurate decisions quickly rather than perfect decisions slowly. She returned to her patient, demonstrating techniques for stabilizing complex injuries with limited equipment. Every procedure I'm doing here could be done better in a fully equipped surgical suite with hours of preparation. But, these patients don't have hours. They have minutes. So we do good enough now, and perfect later.
As the emergency continued, something remarkable began happening among the alien medical staff.
The younger physicians, particularly the students from Sarah's classes, began adapting human protocols to their own capabilities. They started making faster decisions, accepting higher levels of uncertainty, and focusing on immediate life-saving interventions rather than perfect diagnostic workups. Student Zixara, the Vorthan in the containment suit, surprised everyone by successfully performing a rapid fluid resuscitation on a severely dehydrated patient using principles Sarah had taught about aggressive intervention in critical situations. I calculated that the risk of fluid overload was smaller than the certainty of cardiovascular collapse from continued volume loss, the student explained when questioned about the departure from standard protocols. Professor Veltar, who had arrived to observe the emergency response, watched with amazement as his students applied human medical philosophy with increasing confidence and effectiveness. They're learning to think like human emergency physicians, he observed to Dr. Velnesh.
Rapid decision-making, acceptable risk tolerance, aggressive intervention when indicated.
The final casualty shuttle arrived carrying the most severely injured patient yet, a Kythera engineer who had been trapped in a collapsing section of the research vessel. The injuries were so severe that the alien medical protocols essentially offered no hope of survival. Sarah took one look at the patient and began the most complex emergency procedure she had attempted since arriving at the academy. Working with alien physiology that she had studied but never treated, she began a desperate effort to save a life that every other physician present had already written off as beyond help. "This is impossible," Dr. Velnesh said quietly.
"The trauma is too severe, the physiology too damaged.
"Our protocols indicate comfort care only." "Human protocols indicate that you fight until you're absolutely certain there's no hope," Sarah replied, continuing her intensive treatment. "And then, you fight a little longer." The procedure took 3 hours. Sarah worked with a combination of human emergency techniques and improvised adaptations for Kythera physiology, essentially inventing new medical procedures in real time. The alien physicians watched in growing amazement as she stabilized what had seemed like unsurvivable injuries through sheer determination and medical skill. When the patient's vital signs finally stabilized, the emergency bay fell silent except for the quiet hum of life support equipment.
23 Kythera researchers had been brought in with critical injuries.
23 were stable and expected to make full recoveries. Dr. Velnesh approached Sarah, his tentacles moving in what she had learned was a gesture of profound respect among his species. "Dr. Chen," he said formally, "I believe we owe you an apology. And our students owe you a debt that cannot be repaid. You have shown us that medicine can be more than we ever imagined possible." Sarah looked around the emergency bay at the alien students and physicians who had just experienced human emergency medicine in action for the first time. Their expressions ranged from exhaustion to exhilaration to profound respect. "This is what human medicine really means," she said quietly.
"Not just different techniques or equipment.
A completely different relationship with death itself.
We don't accept inevitable outcomes until we've exhausted every possible option. And sometimes not even then."
The ripple effects of the Kythera research vessel emergency spread throughout the Galactic Medical Academy like a carefully controlled chain reaction. Within days, reports of the incident had reached medical institutions across dozens of star systems, carrying with them detailed accounts of human emergency protocols that challenged fundamental assumptions about medical practice throughout the galaxy. Sarah found herself at the center of what could only be described as a revolution in galactic medical thinking.
The Academy's communication systems buzzed constantly with requests for information, demands for detailed protocols, and expressions of disbelief from medical institutions that couldn't accept what they were hearing about human emergency procedures. Dr.
Chen, Professor Veltar announced during what had become their expanded emergency medicine symposium, "We've received formal requests from 17 different medical schools to establish human emergency medicine programs.
The Altarian Medical Collective wants to send a delegation to study your techniques.
Even the Zalari crystal healers are requesting information about human diagnostic methods." The lecture hall had been reconfigured to accommodate nearly 500 students from dozens of species. Word of the emergency response had drawn medical personnel from across the station and beyond, all eager to understand the medicine practiced by beings from what they had previously dismissed as a savage death world.
Sarah stood before the assembled crowd, noting the dramatic change in their attitudes.
Where once she had faced fear and skepticism, she now saw intense curiosity and respectful attention. The alien physicians who had witnessed the emergency response had become advocates for human medical techniques among their own species. "Before we continue with advanced protocols," Sarah began, "I think it's important to address the philosophical implications of what you've witnessed.
Human emergency medicine isn't just a collection of techniques. It's a fundamental approach to the practice of medicine that emerged from our evolutionary environment."
She activated a holographic display showing comparative mortality statistics that made the assembled aliens emit sounds of amazement and disbelief.
Human emergency physicians routinely achieve survival rates that exceed 90% for trauma cases that other species would consider universally fatal. Our battlefield medics save lives under conditions that would shut down most galactic medical facilities entirely. These results aren't achieved through superior technology or equipment. They're achieved through superior medical philosophy.
Dr. Kythera, a distinguished Vorthan physician who had arrived specifically to study human techniques, bubbled with complex harmonics that translated to profound confusion. "Dr. Chen, the statistics you're presenting seem to indicate that human medicine is dramatically more effective than established galactic practices.
How is this possible when your techniques appear so primitive?" Sarah smiled at the question that went to the heart of everything she was trying to teach.
"Because effectiveness and sophistication aren't the same thing.
Human medicine prioritizes results over process, outcomes over comfort, life over protocol."
She began demonstrating techniques that had become legendary among the Academy students. Using nothing but basic tools and her own hands, she performed diagnostic procedures that matched or exceeded the accuracy of sophisticated alien equipment, completed them in a fraction of the time, and did so under simulated emergency conditions that would have paralyzed most galactic medical teams. Watch carefully, she instructed as she examined a training mannequin programmed for multiple trauma simulation.
Complete trauma assessment in 90 seconds.
Airway, breathing, circulation, disability, exposure. Every life-threatening condition identified and treatment priorities established before your diagnostic equipment would have finished its initial scans. The speed and accuracy of her assessment drew murmurs of amazement from physicians who had spent years learning to operate complex diagnostic machinery. Sarah was essentially performing the same functions using techniques that required nothing but training and experience. Student Kilnara, who had become something of a leader among the students adapting human techniques, raised a chitinous arm.
Dr. Chen, we've been practicing the rapid assessment protocols you taught us. But, how do humans maintain accuracy when working so quickly?
Pattern recognition developed through intensive training and extensive experience, Sarah replied. Human medical students spend years learning to recognize subtle signs and symptoms. They practice on thousands of patients in hundreds of different scenarios until rapid, accurate assessment becomes automatic.
She began setting up a demonstration that would challenge the alien physician's understanding of medical training itself.
Multiple mannequins were arranged in increasingly complex emergency scenarios, each requiring rapid diagnosis and immediate intervention. Human medical residents train by handling real emergencies under supervision, she explained as she moved between the mannequins, making rapid decisions and implementing treatments. They see trauma cases, heart attacks, strokes, overdoses, infectious diseases, and every other medical emergency while learning. By the time they become independent physicians, they've already treated conditions that some of you have never encountered. Dr. Valnesh, who had become one of Sarah's strongest supporters among the faculty, gestured with his tentacles toward the demonstration. Dr. Chen, what you're describing sounds extremely dangerous for inexperienced physicians.
How do you prevent catastrophic errors during training?
Close supervision, graduated responsibility, and acceptance that some errors are inevitable during the learning process, Sarah replied. Human medical training accepts that controlled risk during education produces physicians capable of handling uncontrolled risk during practice. She paused her demonstration to address what she recognized as a crucial teaching moment.
Every human physician you'll ever meet has made mistakes during their training. They've had patients die despite their best efforts. They've misdiagnosed conditions, made treatment errors, and experienced failure. This isn't considered a flaw in our system. It's considered essential preparation for independent practice.
The silence that followed was profound. The concept of deliberately exposing medical trainees to the possibility of failure was alien to most galactic medical education programs, which prioritized avoiding any negative outcomes during training.
But, how do you ensure quality control? Asked Dr. Zilkara. If trainees are allowed to make errors, how do you prevent those errors from becoming permanent bad habits?
Sarah began demonstrating what she called morbidity and mortality review, the human practice of systematically analyzing medical errors and negative outcomes to improve future performance. Every mistake becomes a learning opportunity, she explained. Human medical institutions hold regular conferences where physicians discuss their errors openly, analyze what went wrong, and develop strategies to prevent similar problems.
We don't hide from failure. We study it, learn from it, and use it to become better physicians. The demonstration that followed was unlike anything the alien physicians had ever experienced.
Sarah presented actual case studies from human medical practice, including detailed analyses of errors, complications, and deaths that had occurred despite appropriate care. The openness with which humans discussed medical failure was simultaneously horrifying and inspiring to beings accustomed to medical systems that rarely acknowledged negative outcomes. This patient died because we misdiagnosed the condition, Sarah said matter-of-factly, presenting a case study that made several alien physicians emit distressed sounds. Our error was assuming that chest pain in a young, healthy individual indicated muscle strain rather than heart attack. The patient's death led to changes in our diagnostic protocols that have since saved hundreds of similar patients. The concept that patient deaths could be transformed into improved medical care through systematic analysis was revolutionary to most of the assembled physicians. Dr. Kethara bubbled with complex emotions. Dr. Chen, you speak of patient deaths as though they were educational opportunities.
This seems callous. Sarah's expression grew serious. Not callous.
Realistic. Death is part of medicine, no matter how advanced your technology or careful your procedures.
The question isn't whether patients will die.
The question is whether you learn from those deaths to save future patients. She began presenting statistics that fundamentally challenged galactic medical assumptions. Human physicians, working in environments far more dangerous than most galactic medical facilities, achieved better outcomes across virtually every category of emergency medicine.
Human trauma surgeons saved lives that no other galactic species would attempt to treat, she explained.
Our emergency physicians work miracles with primitive equipment under impossible conditions. Our combat medics achieve survival rates that exceed those of most galactic hospitals operating under ideal conditions. The numbers were undeniable, but the implications were staggering for medical professionals who had built their careers around careful, controlled procedures designed to minimize risk. The key insight, Sarah continued, is that minimizing immediate risk often maximizes long-term risk. By avoiding difficult decisions, complex procedures, and challenging cases, you create physicians who can't handle real emergencies when they occur. She began demonstrating advanced human surgical techniques that made the alien physicians gasp in amazement and horror. Working with speed and precision that seemed impossible, she performed procedures that would normally require hours of preparation and teams of specialists. Human surgeons trained to operate under combat conditions, she explained while working. No perfect lighting, no ideal positioning, no unlimited time, no specialized equipment. They learn to achieve optimal results under suboptimal conditions because those are the conditions where surgery is most needed. The demonstration concluded with Sarah performing a complete emergency surgery on a training mannequin in under 30 minutes, using tools that looked primitive compared to alien medical technology but achieving results that matched or exceeded what the sophisticated equipment could accomplish. As the presentation ended, the assembled alien physicians sat in stunned silence, processing concepts that challenged everything they thought they knew about medical practice. Dr. Velnesh rose slowly, his tentacles moving in patterns of deep respect. Dr. Chen, on behalf of the Galactic Medical Academy and the institutions represented here, I want to formally request that you establish a permanent human emergency medicine program. What you've shown us isn't just different medical techniques. It's a completely different relationship with medicine itself. Sarah looked around the room at faces representing dozens of species, all showing expressions of newfound respect and understanding. Professor, I'll be honored to help establish that program. But understand that learning human emergency medicine means more than acquiring new skills. It means accepting that medicine is sometimes a desperate fight against death itself, and that fight requires physicians willing to risk everything to save anything. She paused, letting her words sink in. Human medicine isn't gentle. It isn't comfortable. It isn't safe. But it works. And maybe, just maybe, it can work for your species too. The response was immediate and overwhelming. Applications flooded in from across the galaxy as medical professionals sought training in human emergency protocols. The Academy began planning expansion programs that would spread human medical philosophy throughout galactic civilization. Sarah had come to the Academy as an exchange student from a despised Deathworld. She was leaving as the founder of a medical revolution that would save lives across the galaxy. The students who had once feared her now competed for positions in her training programs. The physicians who had questioned her methods now sought her expertise for their most challenging cases. The Deathworld medicine that had seemed primitive and brutal was recognized as the most advanced emergency care in the galaxy. Standing in the Academy's observation deck, looking out at the stars where human-trained physicians would soon be saving lives using techniques developed in Earth's crucible of survival, Sarah smiled. Humanity's greatest gift to the galaxy wasn't technology or weapons or resources. It was the simple, revolutionary idea that death was not the final word in any emergency. The alien students had learned more than medical techniques. They had learned to fight.